Dear colleagues around the world, welcome to the Life 2021 Nephrology Campus. My name is Peter Stenvinkel. I'm a professor at the Karolinska Institute in Stockholm, Sweden, and I chair this together with Professor Christoph Wanner at University Hospital Würzburg in Germany. So in total, we have 18 webinars about current trends in nephrology. Before we start with the 7th webinar, I would like you as an attendee to be automatically muted and invisible. But you should feel free to ask questions via question field in the go-to webinar in the right corner. So for the 7th webinar, I would like to introduce you to Professor Jeroen Kooman at the University of Maastricht in the Netherlands and Dr. Len Usvyat, who is Vice President of Applied Analytics at the Fresenius Medical Care. And today we will talk about wearable health devices and personal area networks. So it's an honor for me to introduce you to Professor Jeroen Kooman, and he will talk about wearable health devices and body area networks. Can they improve outcomes in hemodialysis patients?
Thank you very much, Peter, for your kind introduction, and good afternoon, dear colleagues, and thank you for watching this webinar. And indeed, in the next 15 minutes, I'm going to talk to you about the potential use of wearable health devices in our patient population. And after a short introduction, I'll go with you through some case examples like detection of arrhythmias, fluid overload, physical inactivity, and also we'll join with you some recent data on the COVID epidemic. After that, this will be followed by a short discussion on challenges and opportunities for wearable devices, and finally I will come to a conclusion. And actually, to get a basic idea of whether wearable devices could be useful, it's good to reflect on the so-called P4 medicine, which stands for predictive, preventive, personalized, and participatory. And it's the hope actually that by the use of these new digital developments, actually the wearable devices, and as I'll come back later to the body area networks, could indeed improve these 4 P's of the future medicine. And this is of special importance in our population because dialysis patients suffer from various organ diseases. Cardiovascular mortality is very high. Beyond that, there's also muscle wasting, osteoporosis, etc., etc. And mortality and also organ disturbances are predicted by changes or abnormalities in physiological functions like abnormalities in pulse rate, arrhythmias, oxygen saturation, body composition, and blood pressure, to name only a few. And these can be detected by wearable sensors, which even those which are available at this moment. But it's important to keep in mind that the present devices which are most commonly used were actually mainly used or developed for consumer reasons. That's important to keep it in mind, that only at this moment relatively few devices to measure physiological functions actually also had FDA clearance or actually were validated in the medical population. So that's still in caveat yet. But if we indeed would be able to get reliable information and accurate information from the devices, it would be great if this would all be summarized within a single kind of a network. We call this also a body area network or a personal area network. In such a network, all the integrated signals after adequate pre-processing could be transferred either online to healthcare providers or actually stored and actually being viewed and at a later time and discussed with the patient. Now going to the case examples, and I'll first focus with you on arrhythmias. And actually most smartwatches at present, also the commercial and the consumer smartwatches, are able to detect heart rate relatively reliable. And they do so by measuring so-called photoplethysmography, by which light by an LED is emitted and reflected back by the tissue. So you see kind of a waveform, and from this waveform, heart rate can be detected. And that's what you can see on even conventional smartwatches. But also some smartwatches have been validated to look at irregularities in pulse rate, as I'll come back to later. And there are also devices on the market which can not only detect pulse rate, but also can detect single lead electrocardiography. And they do so by having an electrode actually at the wrist of the patient and an electrode on the top of the wrist, on the top of the watch, by which the patient can put a finger on, and in this way a single lead electrocardiogram is can be measured and actually also being collected or transferred. How's now the evidence of detecting rhythm disturbances with smartwatches? And this is one very large study. It's the Apple Health study, in which 420,000 participants were included in order to see whether smartwatches could detect atrial fibrillation. And what you can see actually that the incidence of atrial fibrillation or irregular heart rate by the device was in general relatively low, but more than 3% in patients above 65 years of age. And when later on the participants who actually had an irregular heart rate received a patch to see whether they really had atrial fibrillation, it was confirmed in approximately 40% of cases. So it indeed led to case detection of atrial fibrillation. We don't know, of course, at this moment whether this will improve outcome. And for dialysis patients, actually, not only atrial fibrillation can be of importance. Of course, atrial fibrillation is quite prevalent in our population, but what might be even more important in view of the high incidence of sudden cardiac death in dialysis patients is the presence of bradycardias, which often precedes very dangerous rhythm disturbances and even asystole, as has been shown in this study by implantable loop recorders. And it could, of course, be that by using smartwatch-based ECGs, you could theoretically also measure not only atrial fibrillation, but also conduction disorders, bradycardias, etc. But it's also important to keep in mind that for this reason, the smartwatches have not been approved yet. But theoretically, it could well be possible. Now, all this being said, is it to be expected that this can improve outcome? And we don't have any data yet in our dialysis population. What we do know is evidence from patients with heart failure, where telemonitoring was assessed, the effect on outcome, but also the effect of implantable hemodynamic monitors on heart failure patients. And this is really something different, of course, than what I've discussed with you now. These are generally invasive devices surrounded by a whole healthcare strategy, and which is at this moment not yet comparable to the experiences with smartwatches. But that being said, at least the implantable hemodynamic monitoring was in some studies able to improve outcome in heart failure patients. So there's certainly some promise there if we might develop these techniques further. Now about fluid overload. We know from many studies that fluid overload, when measured by not only by clinical examination, but also by, in this case, for instance, bioimpedance, whole body bioimpedance, is associated with poor outcomes. And what we can see here in this large study is that patients who were fluid normovolemic before dialysis had by far the best prognosis, and actually it was followed by worse prognosis with increasing levels of fluid overload. And also importantly, if you look at the cumulative fluid overload over a year, also measured by whole body bioimpedance, especially the patients who had low blood pressure, combination of low blood pressure before dialysis and fluid overload, had worse survival. And now, if you're interested in using, for instance, bioimpedance to measure fluid status in dialysis, it's relatively easy to do so in patients who are treated in a dialysis clinic. But we also have an increased number of patients who are treated at home, and they don't all have these kind of devices, which are still pretty expensive. And maybe actually in the future it would be possible for patients to wear, for instance, wearable bioimpedance measurements. This is already reality in some studies in patients with heart failure. And data from, for instance, a smart vest with thoracic bioimpedance could also detect fluid overload, which then could also be transferred to the care team, and appropriate action could be undertaken. Developments in dialysis patients are also underway, and this study from Belgium showed actually that fluid state assessed by thoracic bioimpedance correlated well with changes in fluid status during ultrafiltration. But whether the use of thoracic bioimpedance in dialysis patients is actually able to reliably measure fluid state per se, and whether its use can improve outcome, also of course needs to be studied. Next, I'll go to physical activity, and what we know, and other groups, and we actually have shown, let's say, all comparable results, is that physical activity is dramatically reduced in patients on dialysis. This is the step count in patients on dialysis as compared to healthy controls. But what you can see here is that even in patients who are not yet on dialysis, physical activity is quite low yet, and actually comparable to the dialysis population. So it's likely more the chronic renal failure per se than the dialysis treatment, which already leads to a reduction of physical activity. And what's more important is actually that, even more important, that in patients who are quite active, dialysis patients who are active have far better survival, even after extensive adjustment, as compared to patients who are never or infrequently active. Now, we can all measure this, but it's actually the measurement per se, accompanied, for instance, by feedback by the device itself, able to improve physical activity. And also in dialysis patients, we don't know this yet, but we know from studies in the general population that activity trackers with appropriate feedback, if you use them without feedback, they do not have much of an influence, but with appropriate feedback and in relatively short-term studies, up till a half year or so, could improve physical activity. It would also be very interesting to study this in our dialysis population. Now coming back to experience in COVID, and from wearable devices we don't have that much experience yet, but what I have I will share with you. This is an example of the effect of the lockdown in the patients from Renal Research Institute on the physical activity levels. And you see that already the quite reduced physical activity in the dialysis patients was reduced even further by approximately 40 to 50%. After the lockdown. So this actually had quite an additional effect on the physical inactivity, which might go unnoticed. What's also relevant maybe for early detection, to increase awareness that the patient might be at risk of developing COVID, is looking at oxygen saturation. And this is not a peripheral oximetry, but this is actually from a blood line, from the CRIT line device, also in a study by Renal Research Institute. And what it actually showed is that 5 to 7 days before patients actually tested positive, already trends in a reduction in oxygen saturation could be observed. And what's more, actually, it appeared to be that it had some prognostic power, as patients who were subsequently hospitalized or even died had lower oxygen saturation actually before diagnosis than patients who were alive or not hospitalized at all. Important to keep in mind that this was done actually on direct measurements of blood oxygen saturation and not with peripheral oximetry yet. If we're now taking to account the combination of different physiological changes, it's interesting to look at this paper from the group of Dr. Usvyat, actually to look at an artificial intelligence model where a combination of physiological changes like changes in temperature, blood pressure and pulse rate could actually also lead to an increased awareness of a future COVID diagnosis. And in this model, actually, it was with a reasonable accuracy, it was indeed able to predict the subsequent positive diagnosis of COVID-19. But of course, it needs to be tested in future trials, whether this really can lead to earlier detection and early awareness. But I think there are interesting results yet. So, how could sensors and personal area networks improve healthcare? And they could increase the 4 Ps of the P4 medicine: participation, personalized care, prevention, and of course it links also healthcare with developments which are well underway, because many of our patients will likely already have smartwatches, smart devices. But the future is likely going rapidly, and it's the idea, the technical idea, that moving from, let's say, the already conventional devices, we will move in the near future to less obtrusive devices, soft wearable devices, patches, etc., who can measure a combination of physiological function, like here hydration status, pulse rate, oxygen saturation, etc., etc. And this all looks very nice, but of course there are also challenges, and the challenges are many. Of course, it needs to be acceptable for a patient to be monitored all of the time. You could also think, of course, of not having a patient monitored all of the time at home, but only at certain occasions, to see, for instance, if they have bradycardias. Many of the devices, as already said, have not been clinically validated yet, and we should be aware that we are not going to use just simple technology because it's there. There should be a rationale and a question behind it. If it's not accompanied by, for instance, by smart AI and smart signal processing, we would have the risk of drowning in data with increased workload for the healthcare providers. It could lead to the medicalization of the free time of our patients on dialysis, just being of a device, the dialysis device, you're being monitored. It could also be sometimes problematic for a patient. We should be aware of findings with unclear consequences and relatively poor specificity of some signals. And very importantly, who's responsible and accountable for the detection of abnormalities by smart devices in which many physiological functions are actually being measured. And it's personally also my strong belief that you should not just, if we are going to use these devices in the future, they should be part of a whole plan, a whole caring network with appropriate definition of accountability, smart pre-processing. They also call this kind smart AI, so that you could have good, reliable signals on which are actable on, and it should be part of a complete network with feedback to the patient. So coming to the conclusion, I think we can state at present that wearable sensors might indeed provide relevant healthcare information which is as yet undetected by conventional methods, because we are also measuring the patients in the time that they are off our dialysis clinic or at home. So it could improve the so-called P4 medicine, prevention and participation by the patient, prediction models, etc. But it's also important to keep in mind that for the great majority of devices on the market, they are not yet clinically validated. And studies in dialysis patients are still scarce, and as far as I know, studies are related to outcome, at least to whether the use of these devices could improve outcome, are non-existent yet. The near future will yield us even less obtrusive centers, and so I think they can really take a further grow here. But we also should be aware that uncontrolled use may lead to, as already mentioned, problems with acceptability, responsibility, workload. And also as already been mentioned, they should really be part of an integral healthcare strategy with smart decision tools, with adequate signal processing, etc., etc. And of course, regulatory and ethical issues need to be solved. With this, I would like to conclude the first part of the webinar. I would like to thank you for your attention. Also would like to hand back the word to Professor Peter Stenvinkel. Thank you very much.
Thank you, Professor Kooman, for this extremely interesting talk. And for all of you out in the audience in front of your computer screens, I would like to remind you that you have an excellent opportunity to ask questions using the question window. And now it's a pleasure for me to introduce the second speaker in this nephrology webinar, and that is Dr. Len Usvyat. And Len Usvyat will talk about wearable technologies and improving outcomes in dialysis patients. Please.
Terrific. Thank you very, very much for, first of all, for the organizers for giving me this opportunity to present today. And of course, good afternoon to everybody. And so as was just mentioned by Professor Stenvinkel, I'd like to talk a bit about these wearable technologies and how we can actually use this data and the technologies that are coming out to improve outcomes of dialysis patients. And so before I jump in, I want to talk about a couple of concepts that I think are important when we talk about wearable technologies. And the first one is this idea about Internet of Things. And I think it's an important concept, especially as it relates to these personalized area networks that Professor Kooman talked about. And so what is this Internet of Things, or IoT as it's often abbreviated? It's a system of these uniquely identifiable interrelated computing devices that can consist of a variety of different technologies, machines. They're able to transfer data over this network without any kind of human to human or human to computer interaction. So these are the things that typically happen automatically. So it's really a network of these devices that we're referring to. And the other concept I want to introduce is this idea of pervasive sensing, which I think is also an important component to when we think of, or at least when I think about wearable devices. And so what is pervasive sensing? Well, it's sensing that happens anytime, anywhere. These sensors can be worn or they can be integrated into our living environment, and they do not necessarily affect our daily activities. So it is not something that we necessarily have to act upon or do something about these sensors for them to function. And again, both of these, pervasive sensing and Internet of Things, these are important concepts when we talk about personalized area networks. So what is, how is Internet of Things related to healthcare, and what does it look like in a healthcare environment, particularly in a dialysis clinic environment? Well, sensors that can collect a multitude of these various pieces of information from both patients and machines, those become part of this Internet of Things network. The data that is collected should really be integrated into the electronic medical records and other types of interfaces. And I think one of the key components, as Professor Kooman mentioned earlier, is that there's this feedback loop that the data that's being collected should be acted upon so that we're actually are able to improve patient outcomes through this entire process. I want to just talk a little bit more holistically about the various technologies. When we talk about pervasive sensing, even though we're focusing on wearables, there's a variety of other technologies that, again, I think Professor Kooman just mentioned. Things like implantable devices are also, to me, part of these pervasive sensing technologies. Things like ingestibles and swallowing, let's say, pills that may have a sensor on them to tell us that the patient actually took a certain medication. And then, of course, a variety of different sensors that can be built into our environment. So things like doing acoustic fingerprinting of a given dialysis clinic that may be giving us insight into what is happening in a given dialysis clinic environment. Not necessarily looking at clinical data, but actually looking at the clinic data. And as I mentioned earlier, I think it's important that when we think about wearables, we should probably think more holistically as these various pervasive sensing technologies. And just very briefly highlight again, what are some of these technologies? What are they able to measure? They can measure things like physical activity, as was mentioned earlier, sleep. They can measure things like emotion and mood. They can measure things like hydration status. They can measure energy expenditure, heart rate and EKG. They can measure things like food and beverage intake as well. And I will certainly say that a wearable technology is a huge market. I think it's something like $40 or $50 billion right now. And as you can see, it's growing quite dramatically, or expected to grow quite dramatically in the next few years. So I want to share this slide with you, and this is actually truly credits to Dr. Peter Kotenko for this graphic, but I think it really illustrates very importantly of why we need these pervasive sensing or wearable technologies. When you look at the screen, it may appear that, that you see very little information. And in fact, what this is actually showing you, these three little windows, this is how much time we actually see our patients in a typical hemodialysis clinic environment. So these three boxes are proportional to the 12 hours that we typically see our patients. And what this clearly illustrates is how little we actually know about what happens to our patients. Even though we all pride ourselves on having lots and lots of patient data in a chronic kidney disease and ESRD environment, it is pretty clear from this picture that we actually see very little compared to what our patients may be doing the rest of the time or what may be happening to them. And this is why it's so important to have access to a lot more information from these wearable technologies. So as you can see here, and again, thanks to Dr. Kotenko for this, but we really only have about 7% of the week that we see our patients. So the next topic I want to talk about is really talk about what are some of the components of wearables, and where has it been shown that maybe there's some data that we're able to measure, or maybe that it's actually been able to improve certain outcomes. And the first couple of examples I'm going to highlight is not actually necessarily about the wearables, but more about things that these wearables can measure, whether they're actually associated with improved patient outcomes. And so this is a study that looked at a study called Navigator Trial, where they looked at the relationship. This is in general population, and they looked at the relationship between the physical activity and the cardiovascular events in patients with impaired glucose tolerance. And what you see based on this from the hazard ratio, you see that for every additional 2,000 steps that the patients are taking, there's about a 10% reduction in the cardiovascular event. So there's certainly some association between the physical activity and patient outcomes. In another example, we have also shown, or in this study, it was also shown that patients with increased walkability also are likely to have less diabetes. So you can see that in this particular study. This was done in Canada, where they've done using the data from the annual healthcare surveys that are conducted on all the patients living in Southern Ontario states, in patients between adults between 30 and 64 years old. What they were able to do is they were able to show that patients who live in neighborhoods with higher walkability tend to have a much lower incidence of diabetes, and they also have a much lower incidence of obesity. So again, this is not necessarily wearable technologies, but this is just showing that things that wearable technologies measure or can measure are in fact associated with improved outcomes in general population. We're going to now turn to very specific dialysis examples. And before I start, I just want to briefly mention, for those who are not familiar with the Fresenius Medical Care in North America, we operate about 2,500 clinics in North America, and we often refer to them as FKC clinics. And so this is equivalent to the nephro care clinics that exist in the European region, for example. And so in this particular study, and this was actually done by Sheetal Chowdhury, where we've looked to see whether things like remote monitoring, whether that can actually help improve patient outcomes. And this was done in the PD population, not in the HD population. But what we're able to show is that patients who are using remote monitoring and who are entering data on what happens to them on a daily basis, or whether that data is collected from some automatic data collection mechanism, some IoT-like device, we're able to show that those who are actually transferring the data, those who are entering their data, those who are more active with those remote monitoring technologies tend to have about 24% lower incidence of hospitalization and hospital admissions, and about a 35% lower incidence of hospital days. And in addition to that, there was also a reduction in the technique failure risk for patients who are using these technologies more extensively. Now, when we turn to, again, dialysis population and looking at neighborhood walkability, we have done this in again, those FKC clinics in North America. We looked at about 10,000 zip codes in the United States. We can actually divide those zip codes based on the walkability index, so how walkable is the community that the patients actually live in. And when we looked at this data, and this was done by John Larkin and Tommy Blanchard and a number of others, what we're able to see is when we try to correlate the walkability of where patients live together with a few patient parameters, we're able to find some fairly strong correlations. So for example, the walkability index was associated, higher walkability was associated with lower pre-dialysis weight. Higher walkability was associated with higher physical composite score from the KDQL, for example. And there was also a negative correlation between the walkability index and the number of hospital admissions, although that value itself was not significant. These various sensors can also tell us a number of other things that we may not necessarily know about our patients. And so in this trial that was done by Renal Research Institute, published by Maggie Han, they looked at these trackers to see how they relate to patient sleep and to try to understand sleep patterns in our dialysis patients. And for example, here we're able to see that patients have a notably lower amount of sleep for those patients who are dialyzed in the first shift compared to patients dialyzed in the other shifts. Just lastly, I do want to highlight also, for example, some of the work we're doing with this BioSticker. This is another device that is able to measure things like heart rate and respiratory rate, temperature, and a variety of other things. And we're actually doing a trial now in Fresenius North America clinics, where these patients and staff are wearing these stickers for about 28 days. And we're trying to see how the survey data that's submitted by patients and the data coming from these BioStickers is correlated when it comes to coronavirus symptoms. Lastly, I do want to highlight, how do I think all of this is actually becoming useful, and where can we actually use this to improve patient outcomes? And I want to mention that in my mind, I think not only the data itself is important by itself, but I think it's actually important when we think more holistically. And again, as Professor Kooman mentioned about this P4 concept, how this data can be used more holistically with other pieces of information we may have about the patient. And so just to give you an example, here at our team, we're doing all kinds of predictive modeling and advanced analytics activities related to event prediction, treatment aid, condition diagnosis, a variety of mathematical modeling work that also happens in the EMEA region. And so just to give you this one example, we have a model that will predict which patients will go to the hospital. Right now, this model is based on something like 1,600 different variables that go into the model itself, into the AI algorithm. But what in my mind, I think where this type of data becomes really important, it's the wearable data becomes really critical in tools like this. If we want to know which patients will go to the hospital, say in the next week, it would be really critical not just to know what happens to patients on those 3 times a week that we see them, but also what happens to them at other times. And so that wearable data becomes really important. Of course, there's a very important caveat to all of this. And just in conclusion, I will say, I mean, data privacy is an absolutely critical component, especially when it comes down to these wearable devices. And so this is something that we truly do need to be very cognizant about. The data, there has to be some sort of patient consent of how this data is collected. And there's always some unintended consequences, as you could see on the slide, of if this is not done in a very appropriate manner in a way. So in conclusion, again, I really just want to thank a variety of people like Maggie Han and Peter Wagispak and Gloria and John Larkin in putting this together. And I want to turn this back to the moderator for the Q&A. Thank you.
Thank you, Dr. Usvyat, for this really interesting talk about wearable technologies. So now is the time to do the question and answer session, and I think we have received many questions from the audience. So here's the first question. Are there any studies suggesting that wearable increase the adherence to the doctor's advice, such as enhanced physical activity? Who want to answer this question?
I'll give it a shot first. In dialysis patients, no data as yet. Therefore, what we know actually more from the studies in the general population of patients, for instance, with diabetes, is that when you use activity trackers, they should have some kind of feedback mode. So just measuring how much steps you have made without getting any feedback on what you should do next actually does lead to less let's say clinically relevant results than when you have an inbuilt feedback system. That being said, it has only been tested, to far of my knowledge, for in studies until 6 months, approximately like that. So we don't really know whether it leads to a very prolonged effect. Most studies, actually randomized trials, were limited to 3 till 6 months. But I think yes, there is some suggestion that they can do, but only when accompanied by appropriate feedback on what the patient should do next.
Len, do you have anything to add?
Yeah, I can just briefly maybe chime in and just to say that, I mean, I think I'm also not aware of any studies that necessarily show that, but I do think that, as you've seen from the example that I gave from the study that was done in the FKC clinics, that using either the wearable technologies or some of those remote monitoring technologies more extensively does in fact associate with better outcomes. And I do think as more of these technologies coming out, and especially, for example, I'm thinking of some of the ingestibles, for example, we would be able to monitor how patients are taking the medication, and that certainly will should show us some additional insight.
What also is very interesting from your studies, Len, in the PD population, that you see if patients who are more active or actually more participatory actually have a better outcome. Wherever there's cause and effect, we don't know yet.
Thank you. Can I have the next question, please? Very impressive technological advancements, but all geared to cause marginal benefit at high cost. What about more effort on technologies to achieve equity of dialysis? Who wants to address this?
Would you take a lead, Len?
Well, I can certainly. Let me just jump in. I mean, I think the first things that come to mind. So, I mean, I think I would argue, I think when we say high cost, I'm not actually sure if these technologies necessarily do have high cost. And I think while they may have high costs in the beginning, I mean, I think we all know that a lot of these fitness trackers and many other wearable technologies are, in the beginning, they may be a little bit more expensive, but I think over time they're becoming less expensive. I also know that, I mean, as we know, I think even many health plans are now thinking about giving out these wearable technologies to their patients because they realize that the cost relative to the benefit is actually not that high. I mean, again, I think in the beginning they were, but over time, a lot of these technologies are becoming much less expensive. So I do think that there's value in as they become less expensive to actually be providing these technologies to wider audiences of patients, and so that everybody is able to have access to at least some of these technologies. I think it has to be very specific to the type of disease and the type of conditions that the patients may have where they would benefit from these from those devices.
And you could also use them, for instance, in patients really at high risk, for instance, let's say risk for bradycardias, etc., to use it more in a targeted way, actually. I don't personally believe in measuring vital functions online all of the time. I think you probably have to take a more targeted approach there.
And I mean, to me, I think this is where the personalization comes into play, as you suggest, Jeroen, that I think really providing these technologies in a much more personalized fashion where some people will benefit from those things. This is where I think the highest value to those technologies.
Thanks. Can I have the next question, please? Are specific parameters already defined to differentiate between the categories of medical wearable devices and non-medical wearable devices? Is this a question for you, Len?
Well, so I mean, I think I can certainly think that I mean, I can maybe start and then turn this over to Professor Kooman. But I can certainly think that there's a number of these technologies and devices that I think they may actually be graded as as medical devices. I think if I'm understanding the question correctly, and there's some that are not. For example, measuring sleep. Or even measuring activity. I mean, there are some that are actually formally graded as medical devices, and some are not. And so I think over time, what we're going to see, and I think we've seen this already, that a lot of these medically graded devices will also be available for more general population, because they're just they've become a lot less expensive to build. And so I think we'll see a lot more of that over time.
Yeah, indeed. And I think, let's say, smartwatches were cleared for medical purposes, as far as I know, are actually only have atrial fibrillation. And in the case of, I think, for instance, the Apple Watch, where they are FDA cleared, but not for the other, not for many other purposes yet.
Thanks. And then I have the next question, please. Do you think BioSticker will become available outside of the US for use in clinical trials? Have you considered combining it with on-the-spot clinician follow-up for patients at home if the sensor indicates change?
I can.
Can Len discuss this?
I can maybe start because I think BioSticker is, I think, something that applies more to the FMCNA clinic. So there's a couple of different trials that are being done. I know that, to the best of my knowledge, at least, I think the company itself, BioIntelliSense, is, if they haven't already, I think they're planning to also make this available outside of the US. So there's certainly, in my mind, I think the work is underway to make this more widely available. And I will also say, I think one of the key things to keep in mind, there's so many other technologies. I mean, BioSticker was just one because, Fresenius actually has a partnership with this company. There's plenty of other companies that are doing a lot of really interesting stuff in terms of measuring. Obviously, heart rate is an easy one, but also chest sounds and other things. And in terms of how do you build this into the workflow of the clinician, I mean, I think that's what we talked about before, that ideally what you want to do is, if you see a change in those parameters, there should be some sort of an automatic alert that would be going to the clinician, be it a nurse or maybe be it a physician, that there's something changing in what is happening to the patient, whether it's heart rate, whether it's blood pressure, whatever it is that we're actually measuring. That feedback loop, I think, is what's really critical in that it's not just some data that is being collected and nothing is being done with it, that there is that feedback loop to making sure that clinicians will follow up and do something about it.
Yeah, if I may comment on that, I think it would be very important actually that you have a kind of a pre-processed signal, that actually only the relevant signals are being put through. Otherwise, you really get a kind of a drowning in data, and there are developments on the way who can do that. But as I see it in personal way, I think, as already mentioned, that all the time monitoring by a patient will simply not be acceptable in the way. But you could think of, say establishing a risk profile for a patient by having him or her wearing such a kind of a BioSticker for several days in a month, and then establish a kind of a risk profile and look at actionable parameters. That's my personal view.
Okay, thank you. And then the next question. This is for Professor Kooman. Do you foresee a future where wearables will become medical devices, regulated by health authorities and subsequently being reimbursed by national health insurance, despite being consumer market products right now?
I think you can only apply them in clinical practice if they are adequately validated and cleared. And otherwise, I would not foresee any reimbursement. At least that would not be my advice. I think all devices which are when they are really going to be integrated in clinical care, need to have adequate validation, which is even more important because distinguishing between physiological parameters like detection of heart rate even can be, and certainly blood pressure, for instance, can be more difficult in the dialysis population because you have changes in vasculature, etc., etc. So I think that they shouldn't only be cleared for the general population. I think they should be specifically investigated and validated in the dialysis population as well. And if that's if that's present, and they have shown their value, I think they should be eligible for reimbursement. Yes, but only after all these. Yeah.
Can I have the next question, please? And this is a question for you, Len. Is having a fundamental knowledge of mobile technology a requirement for someone to be able to use wearables for health purposes? What about less tech-savvy people, like me or elderly?
Well, I mean, I think the first thing that, of course, comes to mind, I mean, I think all these companies that are creating these wearable technologies, I mean, I think their main focus, or one of their main focuses is actually to make sure to create technologies that are extraordinarily easy to use. I mean, I think when we talked about pervasive sensing, I mean, the whole idea is creating something that's extraordinarily easy for people to use. And I think we all know that technologies that are not easy to use and that are not user friendly, I mean, those are the ones that typically will fail. So as you know, as we all know from smartwatches, I mean, they've become easier and easier to use, even for patients who are who may be less, let's say, elderly, or they may have other other conditions. So I think I think there's a move towards making these things more and more easily available and require less and less technical knowledge. I mean, that's one thing. And then the other thing is, I do think over time we know that there's a shift over time that people are actually becoming more and more tech savvy. Even, as we know with smartphones, I mean, a lot more people are using smartphones now that, maybe 5-10 years ago, we thought that folks were not tech savvy enough to be able to use them. So I think there's just a general evolution of that process.
So what about patients with visual impairment? Is this a group that will be forgotten?
Yeah, I don't know. Jeroen, were you going to say something?
No, you were, but just no, absolutely not. But in a sense, it's not, I guess, necessary in a clinical situation that the patient will have to interpret all the data by him or herself. Ideally, they are being, they can also be measured, for instance, and being collected and transferred to the healthcare team, and after that being discussed, an appropriate action being undertaken in any patient, whether proficient in technology or not, visually impaired or not. So I think that's something which is distinct from any patient characteristic that can still be of use.
So now let's see if we have another question. It's for you, Professor Kooman. Wearables can contribute to societal developments. At the same time, they have the potential to widen health inequality. Not everyone can afford a wearable device. How do you think we should reconcile this dilemma?
I think, as I see it, they should actually only be really applied for medical purposes if they're adequately validated, and if they have shown their benefit. I think they should just be part, let's say, of clinical care. For instance, probably in the next years we will have development like Len already showed, and then let's say patients could, for instance, wear some smart sticker, etc., which is actually being provided by just by the healthcare team. So they wouldn't ideally have to buy them themselves. I think they should be integrated into healthcare and adequately reimbursed if they are valuable. So it should not be dependent on any income or something like that.
No, let's hope not. Another question, please. Again for you, Jeroen. Do you think physicians trust in long-term effectiveness of wearable a barrier for their uptake? If so, how do you think such concern should be addressed?
I think only by good clinical studies and adequate validation studies. If you have a lot of noise in your measurements and data which are not reliable, which are not actionable, both patients and clinicians will lose their trust. So that's why I really have a call for a specific validation of any new technologies in dialysis patients. And if they're adequately validated and give reliable results, I think they can be of great value. If not, we should just discard them.
Okay. So let's see if there is another question. It's for you, Len. Which wearable device do you think everyone should have for health, and why, if you have to pick one?
Well, I mean, I think this is a great question. I mean, I think like everything else, there's a bit of an evolution in these devices, and so I do think these fairly basic devices that measure sleep and oxygen saturation, for example, and heart rate. I mean, I think this is and measuring your steps. I mean, I do think there's definitely a value in those, but I don't want to say that I think everybody should have it. I mean, I think this is all like everything else. It's a bit of a personalized medicine. I mean, I think some people need to exercise. Some people exercise irrespective of whether they did the 10,000 steps a day or they didn't do 10,000 steps a day. So I would argue that I don't think there should be some sort of mandate that everybody should have these devices. I think it should be very personalized towards everybody's towards everybody's healthcare needs. I mean, I think for dialysis providers, I do think it's a question that we should be considering, or whether there are some populations where we should maybe consider having them utilize certain devices if they have certain comorbidities, or have scales at home to measure their weight if we know that there's some real issues, for example, with fluid management in those patients.
So today I saw a lot of interesting slides, but I think the most interesting slide was the one you showed, Jeroen, that actually oxygen tension tend to decrease before you get the positive culture for COVID-19. So should we all be wearing oximeters to predict severe COVID-19?
Yeah, it's difficult. It can be part of a kind of a clinical awareness. It cannot to increase clinical awareness. It can never, but it can never replace your normal judgment of the patient, the awareness of when patients come in to see if they have any complaints, etc. But I think no, I don't think we should all wear these kind of devices. If you have the technique available, like for instance in dialysis patients, and you see some kind of irregular trends, then I think you should think again and maybe do an earlier test than you normally would do so. So, yeah, but often also have to be say changes are subtle in a way, but if you see some irregular patterns, and also interesting in the follow-up study, for instance, not only on wearables, but we also saw, for instance, that interdialytic weight gain, for instance, decreased before COVID-19 diagnosis. So if there's some kind of small changes taken together, they can increase your clinical awareness and maybe proceed to earlier testing. That's how I look at it. But not that we are going to. Yes,
are you aware if this observation have been made in other patient groups? This was in dialysis patients, but have it been observed similar?
This is actually, I think it's in a way, these were in RI clinics from a group of Peter Kotenko, where they really validate and measure the crit line a lot. And in this way, because they have this massive amount of data on crit line, they were able to show this. As far as I know, it has not been shown yet in other patient population. But just, because these devices are available there, they were able to study this and to show these results.
Maybe just to make a quick comment, I mean, I think this is, to me, when we talk about these wearable technologies, in a way, dialysis patients are so unique in that we do collect so much data on them. And the various other data points that we're collecting, wearable technologies are like an extension of all the other data we're collecting. So we are only able to know about these oxygen levels dropping thanks to the fact that we see the patient so frequently, which is certainly not the case in the other populations.
Yes. So now let's see if there is another question. Yes, there is. And this is for Jeroen also. Can you describe a wearable or monitoring device that currently does not exist, for which you think if it does in the future, will be an amazing piece of wearable for everyone to have? So
everyone.
Use
so
your
not
crystal
only
ball.
So not only dialysis patients, everyone. Okay, it should certainly be integrated in a way. It just looking at one physiological parameter is likely not relevant. I'm not sure whether a completely healthy patient should actually use all the time wearable devices in a way. I think it should be more targeted, and otherwise we're just measuring and measuring and measuring. But that's not the question. I think if you have a good indication, or when you have chronic diseases, I think a kind of an integrated approach, a little bit like the biosticker, which that was the name, wasn't it, Len? Which integrates, let's say, factors like stress, fluid state, sleep, oxygen saturation, and heart rate changes, and that to then connect this to kind of a personal area network. I think this would really give relevant information, and from that, by smart AI, actually come to a kind of risk prediction and also look at actionable parameters. What can you really do about it? Just measuring what's going to happen is interesting, but it should lead to actionable parameters. So I think that would be not only measuring, but also looking at smart strategies to improve, indeed, the deviations and parameters. That would be my goal for the future, if I would have a say.
And Len, do you have a goal for the future?
No, I mean, I would certainly completely agree. I mean, I think, I don't think it should be a one fits all kind of motto. I mean, I think it should be all very, very personalized. I mean, I actually have a very nice collection of these overview of the various technologies that are out there. I mean, there are devices already out there now that are measuring things that we would have never, probably even 3 years ago, we would never imagine that they existed. I don't think it's anything that should be, one fits all kind of approach.
One thing actually measuring, but we're forgetting here, we're looking only at physiological parameters, but it would also be we would be able to look at, for instance, electrolytes in the future, etc. And that would, of course, for dialysis patients be also be of relevance to detect, for instance, dangerous hyperkalemias.
Okay, I believe this was the last question, and I really like to thank both Jeroen Kooman and Len Usvyat for your excellent and mind-boggling talks. And for you out in the audience, I like to thank you for your participation. I hope that you, like me, have learned a lot. I'd like to remind you that we have the next webinar, which will be the eighth webinar on December 17th. It will be about expanding the patient's voice in nephrology with patient outcome measures. And at that occasion, you will be able to listen to Professor Norbert Lamier and Håkan Hedman, who is a patient advocate here in Sweden. Take care and hope to see you December 17th. Bye-bye.